This is KGW News at 11.
And first tonight, one more chance for snow. This is what many people woke up to early this morning. The snow and ice melted a bit throughout the day, but we could see a repeat tomorrow. Thanks for joining us here at 11 o'clock. I'm Ashley Korsland with Joe Ranieri. And Joe, what should we expect through tonight and early tomorrow?
Yeah, earlier this morning we saw a trace amounts to maybe inch and a half in a few locations. It's going to be less than that heading into tomorrow morning. And it's a short window where we could be seeing some light accumulation, because once we get into the later part of the morning, Ashley, we'll start to dry out. And like you said, we'll start to see a little bit of some sunshine. We're done with the rain for the time being, but there still could be some spotty showers that roll through between now and the early morning hours. And whatever hasn't really had a chance to melt away earlier today, it's going to refreeze. So there could be some slick spots out there tomorrow morning. So be aware of that. We'll zoom in into downtown Portland. We're starting to see some drier conditions after seeing a late afternoon and evening with some showers. We've seen just over close to a third of an inch of rain since midnight. And you can see, looking at the future cast, we're going to be dry really after midnight. A few snow showers along the foothills of the mountains and throughout the coast range. Snow level about 1,000 feet tonight, but some of that cold air could push that snow level a little bit lower, down about 500 feet, maybe to the surface. If that does hold true, we could be looking at some light accumulation right around 6:30 tomorrow morning, and then it carries over into about 9 o'clock. So not a whole lot of time for the snowfall to really start to add up, right? Because heading into the later part of the morning, look at all that sunshine we'll be seeing to wrap up the last day of the year. And going into tomorrow night for New Year's Eve, you're going to be seeing clear skies and very cold conditions. Temperatures tonight will be in the upper 20s. It gets even colder heading into tomorrow night and into Saturday morning. I'll talk more about that in just a few minutes.
Joe, thank you. But we did see a handful of crashes during this morning's commute, including this one in Cowlitz County. A truck went over a cliff near River Road and Fallard just before 6 a.m. It landed upside down and just missed going into the Kalama River. According to the sheriff's office, the driver was not seriously hurt. You can see, though, there was a lot of snow and ice on the road at the time. A crash tonight killed a pedestrian in Troutdale. This was on 257th, a couple blocks north of Stark Street. The driver is cooperating with investigators, but it's not clear if they will face any charges. Starting January 1st, several new laws start kicking in. For some stores in Washington County, that means clearing off their shelves. The county has banned all flavored tobacco, including vape pens and menthol cigarettes. It's an effort to keep those products away from kids. Alma McCarty breaks down the new law and its impacts.
In Hillsboro, Oregon Vape Shop is open for now, but not for much longer.
And this is what we have left. We've whittled down 4 walls of shelving and e-liquid down to this.
The last of their product sold at a deep discount before the store shuts down for good. Owner Christopher Ferreira says that's because of Washington County's new flavored tobacco ban. Enforcement of the rule begins January 1st. The ban also prohibits the sale of menthol cigarettes and flavored synthetic nicotine products.
Flavored vapor products, because we're a vape-only store, was over 90% of our business model. I can't survive on less than 10% of just selling the devices or tobacco only.
Back in November, county leaders voted 3-2 to ban the sale of flavored tobacco, a first-of-its-kind ordinance in the state.
As the public health authority for Washington County, we have a critical role to play in addressing the youth smoking epidemic.
I believe now is the time, particularly as we've seen the industry continue to innovate new products. It's time for us to denormalize the use of tobacco in our community.
Washington County's tobacco prevention coordinator stated in part, tobacco remains the #1 cause of preventable death. Flavors mask the natural harshness of tobacco, making it easier to continue to use. However, Ferreira says he and other retailers don't sell to people under the age of 21. He feels shops like his have been unfairly targeted.
They play parent overseer and thought that by banning just the flavored product, that they were going to get rid of the issue.
Are you really solving for a problem when you're just moving people away? So it really creates a winners and losers situation.
CEO of Plaid Pantry, Jonathan Polonsky, says He has 24 stores in Washington County. While his business may only take a partial hit due to the ban, he's started a petition hoping to bring the issue to the voters.
Washington County couched this ordinance as something to stem youth access. So we have no issue with that, but it's still an adult product and people want choice.
Polonsky says they have 7,000 signatures so far and need 10,000 to get a repeal on the ballot in May. Businesses can face thousands of dollars in fines for violating this ordinance.
Alma, thank you. Well, here's a look at some other new laws taking effect on Saturday. One of them in Oregon will make it harder for jail booking photos to be released to the public. Another allows you to buy cold medicine with pseudoephedrine without needing a prescription. And on the federal level, what's called the No Surprise Act. That will limit how much an out-of-network provider can bill you when you need medical help.
What this does is, so for example, in an emergency situation, let's say you were in a car accident and you had to go to the emergency room, a facility or provider may not bill you more than your in-network co-insurance, co-pays, or deductibles for emergency services, as outlined in your plan documents.
In Washington, the minimum wage will jump 80 cents to $14.19 an hour. Also, restaurants may only provide single-use utensils, straws, and other single-use items if a customer asks for them. We have a list of all the new laws going into effect on our website, kgw.com. Oregon saw another high number of COVID cases today. More than 2,900 were reported, and that is getting close to a record high. You can see a big jump here at the end of this graph on your screen. Now, even though cases are rising sharply, hospitalizations are not seeing near as big of a jump right now. Public health officials have confidence that if you're fully vaccinated and boosted, you are well protected from serious illness and death. Tim Gordon reports.
We got the warning as Omicron arrived, and now it is spreading fast.
We're headed for some uncertain times, and it's going to be difficult to navigate these next few weeks.
In Oregon, new COVID cases were up 25% for the week ending December 27th. And in Washington, 6,140 new COVID cases were reported on December 24th alone, a record-setting number for a single day in this pandemic.
I think we're going to have to get very, very flexible in the weeks to come around how we think about COVID risk, especially in the light of all the services that we all depend on to live day in and day out, that we're going to expect to continue to function as this virus makes its way through.
Multnomah County Health Director Dr. Jennifer Vines believes we are in a lull between Delta illnesses and Omicron's full force. And being vaccinated and boosted is your best defense against getting very sick or dying. In fact, most of us who are in good health and vaccinated will likely manage the symptoms pretty well. The top 5 symptoms are a runny nose, headache, fatigue, sneezing, and sore throat. And yes, most of those symptoms are shared by the common cold and the flu. Getting access to COVID testing is hit and miss right now, but if you can, test. And if it's positive, follow CDC guidelines for isolating. Remember, they've changed from isolating for 10 days now to 5. If you have no symptoms, you can return to work after 5 days if you wear a mask at all times. If you develop symptoms, stay home until you feel better. Isolating at home means staying away from others regardless of vaccination status. Wear a mask while inside and ask others to do the same, preferably with a KN95, KF94, or 3-ply surgical mask. Also, ventilate your space as much as you can and reach out to close contacts and let them know they've been exposed and they should quarantine. Then, stay hydrated and use over-the-counter medications as needed. There are some stats that are good to see. COVID hospitalizations in Oregon are down 35% and deaths down 25% during the past week. Dr. Vines says in order for that to continue, people need to continue to get vaccinated and boosted, step up the masking, and for now, cut back on socializing.
All those little things that we all choose to do add up to whether or not our health systems and our essential functions make it through this wave intact.
So hang on and help out.
And just know that a lot of people are working hard to do the best we can after being handed what is a really difficult situation, especially after what is almost 2 years now of a pandemic.
Tim Gordon, KGW News.
To try and help with the high demand for tests, Oregon is ordering 6 million at-home COVID test kits that will be handed out for free eventually. It comes as the wait for in-person tests has been very long. This was the line we saw earlier this week at the Oregon Convention Center site. Now, these at-home tests will be distributed through health departments and community organizations around the state in the coming weeks.
We know that we haven't been able to provide testing to everyone who needs it in Oregon, and this announcement is a game changer. It really will put testing in communities that haven't been able to access it otherwise, and we're really hopeful that this will help us avoid the worst of Omicron as we know it's coming to us.
Now, a few things to know about the at-home tests. They are not as accurate as the PCR tests that go through a lab. These tests work best for those who are showing symptoms. Also, if you have a known COVID exposure, don't take the test too soon. They work best about 5 days after exposure. The kits come with 2 tests to be taken a couple days apart to help confirm those results.